All right, so we want to thank everyone here for coming to our 10th episode of Environmental Fridays, Season 8. Environmental Fridays, it is personal. So you could go to our website using the link, the URL there, or you can use the QR code in the bottom right. This is a nice photo gallery of our speakers for season 8. And you could see we are here going to listen and hear from Ronald in a few minutes. We also want to acknowledge and recognize the partnership that we now have for the last month, I believe, with the American Chemical Society Committee on in Minority Affairs. Um, So our impact hopefully will grow because of this. American Chemical Society is the largest single discipline scientific organization in the world. And so they could have a great impact in terms of working with us to address issues of the environment. You can join us on Facebook, our Facebook group. Again, we need somebody to mute. Okay, good. So you can simply go to Google and put in Environmental Fridays Facebook group, and you will see the links there. Same thing with our YouTube playlist. I believe the QR code that you see there is for this season. But if you go to Google and do Environmental Fridays, search for Environmental Fridays YouTube playlist, you will get a list of all URLs for all of our 8 seasons. So the month of March, again, time just goes by crazy. We are halfway through, and we have 2 other presentations this month of March. One from the state Michigan Division of Environmental Health, and then one from Lawrence Livermore National Laboratory dealing with the future of sustainable energy, which is hugely important. This month coming up, so March the 18th, that's in a few days actually, um, is a Global Recycling Day. March 21st is International Day of Forest, and March 22nd is the World Water Day. Each of those, there's a lot more information that you could get online just by simply searching those keywords: Global Recycling, International Day of Forest, and National and World Water Day. I think most of these are actually sponsored through the United Nations. So today I'm privileged to have as a co-host Dr. Lisa Benjamin. She's a veterinary epidemiologist, lecturer at the University of the West Indies in St. Augustine, Trinidad. She lectures in epidemiology, veterinary public health, food safety. She is in the Department of Basic Veterinary Sciences at the School of Veterinary Medicine. And I believe she was just saying to me that um, her office, her workplace, is at the Mount Hope Medical Center. And that's just a jog away from where I actually live. When I'm in Trinidad. Her major research areas include antimicrobial resistance, food safety, surveillance of zoonotic diseases. What does zoonotic mean?
So those are diseases that can pass between humans and animals,
Oh,
like
okay.
leptospirosis and so on.
Yeah, there are some. It wasn't there some implication that COVID started that way?
Yeah, COVID is a hot topic
Yeah,
about Japanese
so it's
origin.
still being debated.
Yeah, I think so.
Oh, okay, okay. Um, so she aims to develop practical, cost-effective strategies to improve food safety and combat zoonotic diseases in the Caribbean region. So are there some prominent ones in the Caribbean region that has?
Well, that is one of them, Lab 2. I mean, I think we're pretty fortunate in the Caribbean that, in some other regions they have serious problems. So it's
Okay,
much more, but yeah,
okay,
we have, a few.
okay. Yeah, you will have a great opportunity next season to tell us all about that or anything else that you think is of interest and importance. She also is functioning as treasurer of the Caribbean Academy of Sciences, the TNT chapter, and is an executive member of of Trinidad and Tobago's Office of Disaster Preparedness and Management Volunteer Group, which I just learned is part of the under the national security.
Yes, yeah, but we have just volunteers who are trying, mainly professionals
Uh-huh.
who are trying to assist at a national level to prepare the country for disasters.
Very good, very good, very good. So thank you so much for being a co-host for us today. So it's now your turn to introduce our guest speaker.
Yes, good morning, everyone. This morning, I'm happy to welcome Mr. Ronald Roach, who will speak to us about healthcare, the management of healthcare waste. So, Ronald, who is the Director of Climate Resilience, Environment, Water, and Waste at the regional consulting company Unite Caribbean, has 30 years of experience in the fields of operations management, project management, and waste management. He is an advocate for improved waste management across the Caribbean. And before joining Unite Caribbean, he was a regional consultant and also the former CEO of the Trinidad and Tobago Solid Waste Management Company Limited, where he was charged with providing a strategic vision, planning, and operational leadership to the company. He also served as a director of the Caribbean Water and Wastewater Association, where he advocated for a regional solution to waste management problems. He holds a postgraduate certificate in environmental management from the Carl Duisburg Gesellschaft, as well as a project management professional certification. He holds a Bachelor of Science degree in mechanical engineering and has formal training in quality management, environmental management, natural resources management, and disaster management. We look forward to your presentation, Ron.
So I'll stop sharing, and Ron, you could upload again.
Good morning, everyone.
Good
Uh,
morning.
Thanks for that introduction. It's good being here and to talk about medical waste management, healthcare waste management. It's a subject that falls under the radar in most cases in our Caribbean countries because of other challenges with other aspects of waste management, particularly municipal solid waste management. Um, but it doesn't mean that it's not a very important topic, and it really needs to have more prominence in our societies. So thankful for the opportunity to share some of the work that we would have been involved in as a consulting company, Unite Caribbean. We operate in 20 Caribbean countries. We have offices in Guadeloupe, St. Lucia, Barbados, and presence in Dominican Republic, French Guiana, and Trinidad and Tobago, where I am from. and we operate in a number of thematic areas, including governance, economic and social development, climate resilience, environment, and water and waste management. So, what's the agenda today? We'll talk, of course, very briefly about what is healthcare waste, the importance of healthcare waste treatment, the challenges to healthcare waste treatment, particularly in the Caribbean context, treatment technologies, what are some of the good healthcare waste treatment practices, what are some of the undesirable practices, and then recommendations going forward. Yes, so it's a small group of us. Please feel free to stop me at any point if you have any questions or if you require clarification. Yeah. So what is healthcare waste? In the first place, healthcare waste comprises a total stream from healthcare establishments, laboratories, and research facilities that includes both potential infectious waste and non-infectious waste materials. In addition, it includes the waste originating from minor scattered sources, such as that produced in the course of healthcare undertaken in the home or office. For instance, dialysis, insulation, injections, vaccinations, including COVID-19 vaccinations, etc. So healthcare waste not only originates in medical facilities, but even places like tattoo parlors. And so they do generate healthcare waste. Medical waste specifically refers to the waste generated in the diagnosis, treatment, or immunization of humans or animals. This includes items like used needles, syringes, bandages, and other materials that have come into contact with bodily fluids and may pose a risk of infection or contamination. And infectious waste includes infectious sharps and infectious non-sharp materials. And we will just quickly discuss what those are. So infectious sharps consist of syringes and needles, other needles, blades, infusion sets, broken glass, or other items that can cause direct injury. And infectious non-sharps include materials that have been in contact with human blood or its derivatives, bandages, swabs, or items soaked with blood, isolation waste from highly infectious patients, including food residues, used and obsolete vaccine vials, bedding, and other contaminated materials infected with human pathogens. Human excreta from patients are also included in this category. And just to clarify, when we talk about pathogens, pathogens are bacteria, viruses, or other microorganisms that can cause disease. And just continuing with some of the definitions and explanations, non-infectious waste may include materials that have not been in contact with patients, such as paper and plastic packaging, metal, glass, and other wastes, which are similar to household waste. And a biohazard is a biological substance that poses a threat to the health of living organisms, primarily humans. So what is the importance of healthcare waste treatment? One, it minimizes the spread of infections and reduces the risk of accidental injury to staff, patients, visitors, and the community. So you would appreciate that healthcare waste, by its very nature, can be infectious. People can have diseases, and those diseases can be transmitted, can be contagious, and can be transmitted to the rest of society. So it's important to have proper control of that, to spread infections and spread diseases. And COVID is an excellent example of that. COVID-19 actually highlighted the need for the practices that should have been in place all along. But over time, sometimes the procedures that we are trained on and so become lapsed, and we don't do as we need to. So COVID reminded us of the need that the procedures that were in place at the hospitals during COVID should be in place at all times. It helps provide an aesthetically pleasing atmosphere. It reduces odors, it eliminates insects and vectors, and reduces the likelihood of contamination of the soil or groundwater with chemicals or microorganisms. Again, recognizing that these are pathogens that can be spread and can cause problems in both public health and the environment. So it is important that we treat with healthcare waste in certain ways, and the World Health Organization, certainly in our parts, Pan American Health Organization, and so they have very specific guidelines on how healthcare waste should be treated, how the infectious versus the non-infectious should be separated and separately processed. And again, in our parts of the world where we don't necessarily have the specific legislation in place, we tend to utilize those guidelines provided by the World Health Organization in countries such as the US and Canada and Europe and parts of Asia. And so they have their own specific procedures that they use. But generally, our region utilizes the guidelines provided by the World Health Organization. So what are the challenges with healthcare waste management within our region in particular? So generally, there are limited regulations governing healthcare waste management in Caribbean territories. There are lots of policies and procedures, but not necessarily ingrained in law. So in Trinidad here, there are two overarching policies that guide healthcare waste management in the country, but they are not enforceable. And what you find happening is that in the public service, in the hospitals and veterinary clinics and so forth, there is that mandate that is provided by the government, by the Ministry of Health, to follow these guidelines. But it's not necessarily so in the private sector. So private doctors, dentists, and so forth, tattoo parlors, as I mentioned, they're not bound by those requirements. And whilst many of them, from an ethical point of view, they do abide by it, there is that possibility and that occurrence of private institutions not abiding by those guidelines, and therefore us having implications of medical waste ending up in our general waste streams. And so something that is of concern. And it not only happens within Trinidad, but generally across the Caribbean, there is not that vigorous monitoring of the private sector in particular. There's sometimes ambiguity as to the responsible agencies for healthcare waste management. So waste management, of course, has different categories, healthcare waste management being a specific category of the overall waste management. And again, like in Trinidad here, whereas the Solid Waste Management Company Limited has an overall responsibility for disposal of municipal waste, they have no responsibility at all for healthcare waste management, and that responsibility falls under the Ministry of Health. And again, it's similar in other jurisdictions. Some jurisdictions, it's more clear as to the responsibility of the waste management authorities. Sometimes it is very clear that the waste management authorities in various Caribbean countries have that responsibility, but in practice, they do not, they don't enforce it because of lack of training and resources and so forth. So it falls back to ministries of health in a lot of cases. And whilst there's usually a standard set of procedures from healthcare waste from public facilities, healthcare waste from private healthcare facilities not properly monitored, I just mentioned that. Limited information regarding the storage and treatment of waste from healthcare facilities. So whilst activities are happening, there's limited monitoring and measurement of the waste that is being generated to detect trends, to understand what amounts of waste is being generated and needs to be treated, how is it improving or increasing or decreasing over time and so forth. So like most areas of our society, particularly in waste management, that data and information gathering and processing is not very much practiced. Another big challenge is the limited monitoring of contractors involved in the collection and treatment of medical waste. So In a number of cases, contractors are used to transport medical waste from the point of generation to the point of treatment. And in a lot of cases, those contractors are not properly trained, neither are they properly equipped. And I'll go into some more of that a bit later. Many facilities are not functional or not properly functional. So when we go into the treatment options for healthcare waste, we will talk a little bit more about that. But a number of facilities in the Caribbean that have been set up to treat medical waste, it's not properly working, and therefore it does not provide the proper treatment and the adequate destruction of the pathogens that is required. Let me just pause there. Any questions on anything that I just said?
So I guess one of the things I'm thinking as an overall big picture is that all waste is not the same. I mean, we know that from, for example, nuclear waste, different types of chemical waste. So is that the point also with healthcare waste, that it should be treated differently and separately?
Absolutely. So healthcare waste, yes, represents one of those special waste categories, and it requires, because of the risk involved, the inherent risk involved in handling and transport and management of waste, of that type of waste, it does require special treatment. Yeah.
All
And
right.
we'll go into that treatment shortly.
Okay.
Can you just identify where the guidelines are from? Whose guidelines do we use in Trinidad and Tobago?
So we have adopted the World Health Organization guidelines. Yes.
Okay.
Yeah. But those have been developed into specific policies in Trinidad and Tobago. So there's a code of conduct, and there is a policy on the treatment of healthcare waste. Two documents which exist. One is through the EMA, one is through the Ministry of Health. But they essentially, adopt the guidelines of the World Health Organization. And throughout the Caribbean, so the English-speaking Caribbean in particular, they have all adopted WHO's guidelines.
Okay.
Yeah.
Mm-hmm.
All right. So in terms of the specific good practices for healthcare waste management, first of all, this is segregation into infectious and non-infectious waste. So that requires having separate bins, having separate color-coded bags, so that the infectious or potentially infectious waste, because in reality, we don't necessarily know what is infectious, but any waste that contains bloods or bodily fluids, bandages and syringes, as we spoke about before, has the potential to be infectious and therefore must be separated from the rest of the waste that is non-infectious. So the non-infectious waste will include things like packaging and food waste and so forth. Syringes or needles are collected in a puncture and leak-proofed container with color coding or bearing a biohazard sign or symbol. So that sign on the right-hand side there is the biohazard sign. It is the standard symbol used to identify biohazard content. Non-sharp infectious wastes are collected in bags with color coding or bearing a biohazard sign symbol. Infectious waste bags and sharp containers are safely handled and transported on site. Infectious waste bags and sharp containers are stored in secured places prior to transportation for treatment or disposal. And that's one of the big gaps that we have, where it specifically says it requires to be stored in a secure place. What does secure mean? It means that the general public or the unsuspecting individuals do not have access. So there must be a locked system. And too often throughout the Caribbean, there's no exception. These wastes are sometimes stored in areas that are accessible to the public. And I'll show some pictures of that shortly so that you can see what I mean. Availability and use of personal protective equipment and facilities for washing hands for all persons handling waste, immunization of staff against hepatitis B virus, regular supervision, and the correction of problems. So there needs to be a system of monitoring. Again, what too often happens in our countries is that a system is set up and there is no monitoring that is taking place, or inadequate monitoring, and over a period of time, the system just falls apart and what should be done is not being done as it should be. And again, I'll go through some of those specifics shortly. And just very generally, what are some of the key steps in healthcare waste management? We need to start with waste minimization, determining areas that we can reduce the amount of waste in the first instance. So purchasing in bulk is one of those areas where, again, we can have some improvements. And then with respect to the waste generation, from waste minimization, then you go to waste generation, and that waste must be segregated and containerized, and it must then be moved to intermediate storage. From there, we have internal transport within the facility itself. So just imagine you have a large hospital facility. Waste is being generated in the wards, and it must be stored there initially. From the wards, it then goes to an intermediate storage, maybe a section of the block where that ward is. And then there is internal transport that transports it to a central storage facility, from which it's then transported to the final treatment and disposal. There are many facilities where that treatment and final disposal exists at the facility itself, in which case it just goes, it's internally transported to that facility. So those are the key steps in healthcare waste management, from the minimization to the generation to treatment and final disposal. And it's important to recognize that at each step, we have to be able to separate, to segregate, to identify, to properly store and properly manage and properly transport. So all those steps require management and monitoring for the system to work fully. So there again, I say this in the context of the fact that there's sometimes we have very good segregation procedures at the wards, but the intermediate storage and the internal transport is not properly well done, and we can have problems. Shops is a special aspect of the healthcare waste management system. So shops include syringes, as well as vials that contain medicines, and so that can be breakable. And usually there is need for a special container. So you want the picture on the right-hand side. It's a typical container used for shops. And you will see at the top, there is just a small opening to allow the shops to be placed. And therefore, we must not put shops in the bins. We must not flush it down the toilet. We must not put it in beverage containers. And we must certainly not try to recycle it. Incidentally, in the ICARE project and at SwimCall's facilities, we have had in the past persons putting shops in containers and putting it in the recycling stream. I believe all with good intention, thinking that the plastics can be recycled. But once a needle is used, it should be destroyed because there's the possibility of pathogens. Yeah, so moving into healthcare waste treatment technologies, because medical waste has its challenges with pathogens, there is need for specific treatment technologies. So I'll just go through a number of those technologies. The first one and very common one is that of incineration. So incineration is a controlled burning of the medical waste in a dedicated incinerator. Incineration is an established technology and was widely used in the past for various types of waste. Still very widely used. However, use of incinerators is in fact decreasing because of the air pollution risks that they pose. And the two pictures below show two different size incinerators. So the first one is a typical incinerator you may find at a small medical facility, and the one on the right is a major incineration plant for maybe an entire community or so. So what incineration does is that through high temperatures, it destroys the pathogens and renders them, well, it destroys them. So they're no longer harmful. And that's the main purpose for incineration. The thing about incineration is that there must be an external fuel to drive these incinerators. So that fuel could be diesel or it can be natural gas. And again, one of the big challenges in our countries, in all the countries that I've been involved in, we sometimes have incinerators when it's built, it's properly functional, and then it slowly starts to go bad. So the air pollution equipment stops working, and then the fuel system stops working. And what ends up happening is just the shell of the incinerator continues to be used. So there are a number of instances where medical waste is put into the incinerator, and then the attendants take some newspaper and they light the medical waste using that newspaper. And that is a very harmful practice. What that does actually is take that medical waste, and instead of destroying the pathogens, because it's not being burned properly, the pathogens are then diffused through the atmosphere by burning in the absence of the conditions necessary to destroy the pathogens. So that's something that's, as I said, it's quite destructive. It can spread pathogens and spread the problem rather than deal with that problem. And it's something, as I said, that has happened in multiple cases throughout the Caribbean. So it's something we have to be very mindful about. And yeah, I mean, please take note that the incinerator technology is being used less because of the air pollution risks that they do in fact pose. Another form of treatment is that of autoclaves, and an autoclave is a closed chamber that applies heat and sometimes pressure and steam over a period of time to sterilize medical equipment and medical waste. So similar to incinerators, it destroys the pathogens, but by heat treatment, by steam treatment, rather than by pure heat. So autoclaves are becoming more common, and the reason for that is that they are considered chemical free, and it appeals to many stakeholders. However, autoclaves are not suitable for body parts in particular. So if you have amputations in a hospital, and so autoclave is not the best treatment for that, because there is not the sufficient guarantee that the steam will penetrate all the entire amputated part, and therefore they can have pathogens still remaining. So we should be mindful of that. Yeah, so volatile and semi-volatile organic compounds, chemotherapeutic waste, mercury and other hazardous chemical waste, and radiological waste should not be treated in an autoclave. Large and bulky bedding material, large animal carcasses, sealed heat-resistant containers, and other waste loads that impede the transfer of heat should also be avoided. One thing to note is that whereas an incinerator not just destroys the pathogens, but also reduces the volume of the waste by as much as 90%. An autoclave, the waste that goes into the autoclave is the waste that comes out. It's just that the pathogens are no longer there. So if you put in a body arm, a body part in the autoclave, it comes out as a body part, and therefore you have to be mindful of that and mindful of how that waste is now treated. In a lot of cases, what is done is that the waste is then shredded to avoid those aesthetic problems. And moving on to microwave treatment. So microwave treatment is another form of treatment similar to autoclave, but in the steam that is produced in a microwave is generated by microwave energy. So the only difference is the source of the steam generation. In an autoclave, it's the steam is generated by a typical boiler. In a microwave, the steam is generated by microwaves. And in the microwave system, the same thing applies. So when you have waste going in, it's that same waste that comes out, and therefore all the conditions that apply to autoclaves also apply to microwaves. Microwave technology is much more recent than autoclaves, and simply compared to incineration. And it's not widely found in the Caribbean. So in the Caribbean region, there are actually two microwave units in Tobago. There is in the French islands, Guadeloupe and Martinique. And outside of that, I'm not aware of any microwave units in operation in the Caribbean. So it's quite new technology for the Caribbean. And this is what typical microwave units look like. There's also mechanical and chemical disinfection. So mechanical treatment involves shredding or pulverization of waste. And of course, because it's just mechanical, it does not kill pathogens. However, it can be used to reduce waste volume. So mechanical destruction is usually accompanied by, as I would have mentioned, either the autoclave system or the microwave system. Whereas chemical disinfection, primarily through the use of chlorine compounds, kills microorganisms in medical waste and can often oxidize hazardous chemical constituents. However, chemical disinfection is most appropriate method to treat liquid medical waste. So treated liquid waste can usually be discharged into the sewer system. Sometimes it goes into a holding tank for testing before discharge. Yeah, so chemical disinfection is generally limited to the treatment of the liquid medical waste. And then there is landfilling. And a question I have for you is landfilling an acceptable form of disposal of medical waste from what you understand of medical waste so far? Anybody willing to answer that?
I would
I
say
would say no.
no. Not at all.
All
I would
right.
say only if it has been decontaminated.
Okay.
Right. Anybody else?
I think it depends of the type of medical waste.
Yeah, so generally, yeah, when we talk about the medical waste, it includes all the different types. So interestingly enough, landfilling is considered a last resort, if no other treatment options are available. And in fact, a lot of the medical waste within the Caribbean is still landfilled. In a number of cases where incinerators or autoclaves are no longer functional, they revert to the process of landfilling. However, there are some specific requirements that if it's landfilled, it has to be deep buried within the landfill, and it has to be a properly secured landfill site. So the sites that we have in Trinidad at VIII, for instance, does not qualify as a landfill, because there is no underlying liner, and therefore landfilling is not an acceptable means of disposal in a case like that. However, if it is a secure landfill where there's an underlying liner, and so as I said, in the absence of other forms of treatment, or as a last resort, you can in fact bury the waste. It has to be deep buried, and it has to be away from the public areas. So in areas where the general waste is being disposed, you don't want to be burying waste in those areas. Yes.
Question. Does that mean that Forest Park, if it comes into operation, could be possibly properly secured, properly lined to be able to deal with medical waste?
It does. However, I mean, in the Trinidad context, there are major incinerators. There are incinerators at some of the major institutions already. So hopefully we don't have to go back to disposing of medical waste in a landfill. I think our priority is to ensure that those treatment facilities that are already in place, they continue to function for the foreseeable future. The system that we have at Mount Hope, for instance, is a very good system. San Fernando has a fairly new system, although they're getting some problems with it now. Point Fortin has a new system. Tobago has a couple new systems. So hopefully we don't have to rely on landfilling as a form of medical waste treatment in Trinidad. Yeah. But like right now in Antigua and Barbuda, in St. Kitts and Nevis, in St. Lucia, all the medical waste from those countries is being landfilled currently, because there are no other forms of treatment. Yeah.
Is that a question of economics?
Yes, it is. Because the reality is, yes, whether it's incineration or microwave or autoclave treatment, the treatment technologies for medical waste is much more expensive compared to landfilling. So landfilling usually is the cheapest form of treatment. And again, sometimes what happens is that you have, so in the case of St. Lucia, in St. Lucia, there is an autoclave facility that is now more than 20 years old, and that facility is no longer functional, so they are once again landfilling. However, they're working on procuring a new autoclave facility. So hopefully, in the near future again, they should once again be autoclaving and not landfilling.
So in those territories, are they doing it properly with appropriate lighting first and so on?
So yeah, yes, definitely those the landfill sites in those countries are in fact sanitary landfill sites. They do have liners and leachate collection, and so it is done as best as it can be. One of the challenges that I've seen is that Whereas when you dispose of medical waste, you need to cover it at once, again, to avoid spread of disease. And so sometimes what happens just from I guess a logistics point of view is that they will leave a particular hole that is dug open for a number of disposals up to a month and so. So that's something that should not be happening, that is happening. But in terms of the actual disposal itself, at the facility, it's acceptable.
Another question is the kind of lining used. Does it outlive the life of the pathogens?
Yes. So if properly built, it is supposed to. And again, overall, whilst we're talking about medical waste management, the reality is waste management standards and procedures in the Caribbean is not where it needs to be. So like in developed countries, you have a landfill that has a life of 30 years, and then the company that is managing the landfill has to monitor for an additional 30 years after the landfill is closed off to make sure that the liners and so remain intact. Unfortunately, we don't have those type of systems here, but generally speaking, yes, I mean a liner should last um, for for many years and would definitely outlive the life of pathogens. Yeah. All right, so transforming what I just said into some pictures, just want to show some good practices and good and very good practices that I've observed within the Caribbean, and to point out some not so good practices. So in this case, this is a sharps container, and what's good about it is that when you look down into the container, you only see sharps. And that's something that's very uncommon. As simple as it may sound to have sharps in a sharps container, usually when you see, and hopefully I do think I have some pictures of undesirable practices under sharps as well. But sometimes you see a lot of bandages and packaging and so in sharps containers, which should not be. So why I have this as a good practice is simply because of the lock on the container. As I would have mentioned earlier, one of the requirements is that once you have biomedical waste being stored, it needs to be secured. And we don't deal with that security often enough, and a lot of bins and storage areas as in many cases not secured. The biohazard sign at the side could do with some work, but otherwise at least there's a lock and it's secured. So on the left-hand side, 3 different bins, each with and you have a sign showing what is required. So yellow bag, the shops bin, and then a general waste bin. So generally good procedures along with signage. On the right-hand side, again, showing proper signs identifying what the storage is for. So this is a picture in Trinidad showing the biohazard sign on the truck that is transporting biohazard waste. So clearly marked, and the cabin is separate from the container is separate from the cab, which is one of the requirements. So in contrast, a lot of our countries, we still use 3-ton trucks as an example to transport waste. And that same 3-ton truck that is used one day for medical waste is used on another day for transport of other types of materials. And that should not be so. Your transport should be dedicated. So this truck should only be used for biohazard waste, nothing else. very good, very sturdy bin, covered, and has a foot pedestal. So you want to minimize contact with waste. So it's recommended that you have bins with foot pedestals. And this is one of the microwave treatment units that I referred to in Tobago. And as you can see, the area is very clean, so it doesn't look like waste is being stored. And there's a scale at the side so they can actually measure the waste. I spoke about lack of measurement and so whether or not they're using it is a different question, but at least the facility, the equipment is there to be used. So that's some of the good practices. Unfortunately, I have more undesirable pictures of undesirable practices, so I'll show you some of these. In this case, it might look simple, but two problems here. So it's a bin it's a bin for bio waste. One problem is the bag is too big for the bin. Second problem is that there is no lid on the bin, and that's certainly one of the requirements. All these bins must be covered, again, to prevent transmission of disease. So this is a shops bin that has quite a lot of contamination. So you see some shops, yes, but you also see a lot of paper and plaster backings and so forth. None of those should be there. And really it comes down to cost. Why there's need for segregation is that it's expensive to treat medical waste, and therefore you want to ensure only those wastes that need to be treated are included in that. Otherwise, your cost becomes astronomical, and therefore things that do not require treatment, like your packaging and so, should not be put in the shop's containers. Another example showing again the packaging for medicines, and so that should not be there. So the bin on the left, challenge with it is that there is a biohazard sign on the bin, but it's a black bag. And therefore, when somebody picks up that bag, you don't know where it's going to be put, and it creates confusion. So certainly undesirable. On the right-hand side, again, just bags that are too big for the bins, and again, a waste of resources. Here too, you have red bins, which signify that it should be medical waste, but then you have black bags and you can't distinguish. So as opposed to the picture that I showed of a bin with the lock and with the sign, this is the exact opposite. So it's a bin that seems to have a sign. The sign is not eligible, and the bin has no means of being secured. On the right-hand side, we have a clear labeling, a biohazard waste area. But look what is holding up the door, a piece of 2x4. So very insecure means of storage. So just too much waste being stored, and again, no security. The bin is full and they're packing on top of the bin, and so undesirable. This picture shows, again, waste that's being stored and in view of the public and in where the public can access, so should not be. And again, not enough clarity in terms of two bins, one with a clear bag, one with a red bag, but no other signage to indicate that, yes, really one is for medical waste and one is for general waste. So lack of signage. Here, a lot of different things in all the same bins. So some red bags, which suggests that it's medical waste, but then a number of black bags, and so lack of segregation. And this is actually an operating facility. This, I mean, everything is so wrong with this picture. Yeah, so those are some of the real issues that we have in the Caribbean. And in terms of just summarizing with some recommendations, overall, of course, more attention needs to be placed on the proper management of healthcare waste. So it is a special subset of the overall waste management sector that needs to be focused on. Some countries have indeed provided more focus on it, but there is still a lot of work that needs to be done. Even here in Trinidad, we have some of the best facilities and best practices, but we also have some of the worst, and at different times. So you have a new incinerator at a hospital, or the new microwave, and it works well for some time. But we don't keep the maintenance up and the monitoring up, and then, things fall apart. So we have to be mindful of that. There's need for policy and legislation improvements across all our Caribbean countries. So there's no country that has all the legislation in place to properly manage healthcare waste. It's something that needs improvement throughout. Responsibilities for healthcare waste management must be made clear. The responsibilities of the authorities, in particular, where for those countries that have waste management authorities, and for others, it needs to be, specifically agreed who has the responsibility. And then the next point, for those who have those responsibilities, the adequate resources must be provided. So again, one of the challenges with the medical waste management system. And then finally, more training and development is required for healthcare waste management in the Caribbean. So it's not something that a lot of emphasis is placed in over the years through consultancy. We have done a number of sessions of waste management training in medical waste management training in various Caribbean countries. But these are one-off sessions, and what we try to do is to get the persons at the hospital to take on that responsibility. There, in some cases, nurses responsible for infection prevention and control who have been working for 20 plus years and have never had specific medical waste management training. And so it's something that is required throughout. That is it for the presentation.
Well,
Yeah.
Questions, comments, feedback?
Thank you so much. Lisa, you want to get a...
So thank you. Well, I guess at first I should invite other attendees to, if they have any questions, straight off.
Yeah, I truly appreciate this presentation. For example, it never occurred to me to wonder what happens to body parts that are amputated. But
yeah, I know.
And I know that this is about the Caribbean, but I've had this question living in the US. There's provision, for example, at the police stations for you to return unused medication waste. And I've often wondered if the empty containers, little plastic containers that the medication comes in, if that should go in general waste or if it should be also returned along with the unused medical waste. So that's a question that you probably can answer.
So the packaging itself, if the medication has been used, can go into your general waste. And it can perhaps, depending on the region you're from, can perhaps go in recycling as well. But once you still have medication, yes, it's better to carry that back to, if you mentioned the police stations, is what takes it back, because of course that medication has the potential to contaminate water sources, and so you have to be careful about where you send that. But the empty packaging can go in either one of the waste streams.
So like for example in vet medicine, I know you spoke about private places not being as well monitored as the public places. So you would have a number of practices. You might have some people being, doing house calls and so on. And of course, they would generate waste. What are the options then for these private facilities?
Right. So the option is always to liaise with your Ministry of Health or for the nearest hospital. So in the case of Trinidad, in the case of a lot of the Caribbean islands, the responsibility is through the the healthcare the healthcare system, the Ministry of Health in particular. So again, it depends on, so in Trinidad, for instance, there are private contractors that will pick up your waste at a cost. They will provide the bins, and then, you arrange with them for weekly service or whatever frequency is required based on the amount that is generated. So when you go to the Ministry of Health, they will advise you who the private collector will be, and they will make arrangements. Now, if it's another government institution, then the ministry itself will take that responsibility. So the the facility in Mount Hope will receive healthcare waste from other facilities within that region. And that applies even to like the clinics. And so people who are attending clinics, they can bring back their used syringes. The clinics encourage you to bring back your used syringes to the clinics, and then the clinics will make that arrangement with Mount Hope to collect and treat that collected waste, those syringes, those shops. Yeah. In other countries, in St. Lucia, for instance, the government takes on that responsibility. So once you call them, they will assign a contractor to collect that waste. And it's actually free of charge. So different countries have different mechanisms, but there is usually at least one system within a country. And you mentioned little monitoring. I will go as far to say there's no monitoring there. Absolutely no monitoring that takes place. So there are no records. The ministry can't say whether a private institution is using one service versus another and so on.
Any other questions?
So one of the questions that comes to my mind is, how is waste segregation done at the level of the homes? Because, we talk about the factories, the institutions, the organizations and stuff, but at the level of the homes, is there any sort of guidelines, mechanisms? Because I'm assuming at that level of individual homes and houses that all the waste just basically goes into the same thing.
So at the level of the home, generally what you may have is used syringes. So persons with various diseases that need to take like insulin, you would have syringes being generated. And throughout the Caribbean, there is the system where they encourage you. So you'll usually get your syringes from your clinic and so. And the clinic will advise you to put it in a rigid container like a Clorox, a bleach spot,
Oh,
bleach
okay.
bottle. You need to properly label it, and then you return it to the clinic. So whether you got it from the clinic or not, you can in fact return it to the clinic, to any clinic. So again, there is not sufficient monitoring to identify what proportion of persons who actually get who use syringes and so actually return it. But I mean, if you go to any clinic, they will have records of people that do return to those clinics. So it's something that does happen, but of course, at the same time, we have to recognize that in a lot of the landfill sites, we do have syringes and other types of medical waste coming into the landfill site. So it means that the system, there's need for improvement of the system.
What about masks, especially during the time of COVID?
Yes. So ideally, well, I mean, there's been different studies that has come up with different results, but generally it was felt that the COVID virus, between the time of you putting a mask in the bin and the mask reaching to the landfill, that the risk will be very minimal. So it was allowed. Again, certain countries did have specific precautions in dealing with waste from homes that were identified as having COVID patients, and so. But generally speaking, yeah, the risk was identified as low,
I see
non-existent.
Nisha Smith.
Sure.
You can just put on your microphone and talk. Nisha.
Good morning. You can hear me clearly?
Yes.
I apologize at first. I would have joined in late. I had a meeting before, but it's such a beautiful and excellent discussion. I know that I had to come in. I do have 3 comments and 2 questions actually. So I am the technical officer at Swimpole currently, and I heard parts. Oh gosh, I got bits and pieces, but parts of where we spoke about mixed waste or commingled waste coming in. We see that a lot. So we do have general waste bins at the hospital for general waste, of course, because people may have a drink or a snack. But oftentimes, even workers would maybe put some of the biohazardous waste, unfortunately, in those general waste bins. So when persons or the drivers go out, they should be, most of them are trained to recognize, no, this should not be there. We're going to leave the bin until they are able to separate and segregate the waste type. But sometimes, only when you really carry the bin to the landfill and you decant or empty it out is when you see what may be underneath, unfortunately. And then we have to now charge differently and send the waste to the appropriate pre-treatment service provider, whether it be an incinerator or, the case. So I just wanted to mention things that would happen right now currently. So it's very, very, very prevalent, unfortunately. But it was right on, that comment was right on point. With regards to syringes, this is my second comment, we see syringe within the recycling, like the bottles to be recycled. So the post-consumer beverage containers, they're going through it at the beverage container recycling facility, that's at NAMDEPCO. Go through it, you're putting together the different colors, and then you will bounce up 1 or 2 with syringes in it. And I think people think that they would open it out and recycle the bottle still, and then separate the syringe to send it to a pre-treatment service provider or TSDF, a treatment storage and disposal facility. However, because it's touched, it's contaminated, we actually try our best to get rid of even the bottles around it, just to make sure there's no kind of contamination, especially if you see like a drip of blood, or if it's not covered, especially. So all these things are still happening. I'm not sure why persons will think, let me put the syringe in their bottle and put it in the recycling bin, but it happens. So now we're on, on to my 2 questions. I do see applications. So just a backstory, I oversee the special waste, which is more so of the potentially hazardous waste that will come in from industries, commercials, places, or institutions being hospitals as well, over-the-counter medicine. So your Panadol, your Andrews, your, the regular stuff you could buy. The method that we choose we look at both what the customer could afford and then what the best practice method that we could advise. Sometimes it's at a small quantity, we opt to shred and then make sure it's contained and then go to the landfill. As my main question is, as we honing in or being specific to these, it's not the medication that we have to be, what do you get again? A prescription is over the counter. And I know the issue is more so when it goes to the landfill, if like liquid gets it, it will affect or impact the aquatic environment. So I'm just asking, I guess, for advice on how we go forward with resources that we have with regard to the over-the-counter stuff that we may get, and especially when it's in small quantities. If it's a larger quantity, we may tell them, no, you have to treat it in the entirety of that method. But when it's a small quantity, like a few boxes worth, that's my first question. Do I go on to the second or wait?
Yeah, you can go ahead.
Okay, the second question is, we often see a lot of mixed residential where the upstairs is a home, but the downstairs is a doctor's office. Yeah, and they employ oftentimes the your regular municipal garbage collection. And then so everything is coming mixed up. And sometimes you would see where there are how to say it, informal recyclers or salvagers at the landfill, and they may see bags coming out with like the tubing with blood or bed sheets with human fluid stains on it. How do we go about, because it's not a, I don't want to like not take, because we still have responsibility. It's not a swim call thing to go by each the household with the doctor's office at the bottom and say, don't do that, because that's a big task. But the municipalities, and how do we go about just informing them and letting them know it's like they have to have a separate waste stream. They have to deal with it separately. That because you live upstairs and you have a business downstairs that's a doctor's office or, pediatrician or whatever it may be, that you could just send it through the regular municipal waste stream, because it's municipal landfills that we have, not hazardous or biohazardous or things where those type of materials could be treated. So I guess that's the two questions of advice that I'm asking, and how to go about it, just lead that change.
Yeah, thanks, Nisha, for those comments and questions. So just to respond to one of the comments as well, I think that the persons who are sending those syringes in for recycling, I think they actually think that they're doing a good deed and sending their syringes to be recycled without understanding the dangers involved. So I think it's something that, it definitely requires greater public education to alert people about those dangers. The Ministry of Health did have a sensitization program a couple of years ago, but it's of course not been as extensive as I guess it should have been. And then with respect to your particular question, so I think in terms of the medicines, so certainly encapsulation is one means of treatment, and I know there is a cost it, and for small quantities, I guess it can be where you have a storage system until you have enough quantity to justify encapsulation. That's the best thing. I can't recommend putting it into the waste stream at all. But I know sometimes you may need to do so. But the best thing that I can recommend is just storing it until you have enough to be able to encapsulate it. And then with respect to I know it's a big problem with these private institutions not doing what is the right thing. Unfortunately, the laws are not there, and therefore there is no penalties that can be imposed on them. However, I think it's important to document those and forward them to both the Ministry of Health and the Environmental Management Authority. I certainly would have done that on occasion. Unfortunately, the Environmental Management Authority has indicated that it was not a priority of theirs, but hopefully at some time it will become a priority. But certainly, letting the Ministry of Health know, I think is also important because it continues to be a problem, and yeah, it's something that needs to be addressed.
I was just wondering if you would have contacted like the medical association as well as the even the faculty of medical sciences in terms of the training of these people, because the thing is, you know, you would learn some things on a theoretical level, but practically what do you do? Would that information be available to them during training?
Good question. So no. But yes, I agree that that might be an avenue to be able to address the situation. On a personal level, there are times that I go to the doctor and ask them what they do with their waste, and they can't tell me, and so on. Then I recommend the contractors, and I've actually done that, and then seen the next time that the contractor is now being utilized. So I encourage people to do that as well. Because I mean, collectively we have to make our voices heard to be able to have these issues addressed. The more people that speak up against it, is the more likely that that these challenges would be addressed.
I see Patricia McGraw.
Okay, sorry.
Sorry. Patricia.
Thank you. First of all, you have a list of these contractors that collect, because I know one or two people that might be relevant to. So if you could share that, that would help. But the other thing I would like to say is that the garbage collection in the UK is is relatively, not very, but is relatively well conducted, and waste is well separated. If by chance you put the wrong piece of waste in the wrong container, they refuse to collect it. So if you had one item that was incorrectly placed in that particular bin, they would refuse to collect it. And if it's a kind of like, in one case, when my husband tried to put a wine bottle in the standard kitchen waste, my daughter just about went ballistic. Just a thought, and kind of, but so the people collecting the waste should have the facility or the option to be able to refuse to collect unsuitable waste. Is what I'm saying. Does that make sense?
Yeah, absolutely. The thing about it is that that is so because of the laws that is in place in the UK, and those equivalent laws are not in place in our countries. So as I said, there's no country where there are sufficient laws in place for specifically handling and treatment and separation of medical waste. So that's one of the challenges. We have to create the laws. We have to get the laws implemented to be able to have that and to be able to penalize that. There's a case in the US recently in Virginia where a hospital was fined $1 million+ because just because of negligence, they ended up putting medical waste in the general waste stream, and it entered to the municipal landfill. And because of that, they were fined. And those are the things that that we need to implement in our countries. But it starts with having the law in place.
Gloria.
Yeah, masks were mentioned. This is not exactly health related, but it's still environmental. That the recommendation was that you take off the straps before you dispose of it, because they were finding, I think, birds tangled up in masks. So before you dispose of it, you take off the two ear straps or whatever it is. Also, I had a question when household waste was mentioned. What about if you use a bandage on a cut or something like that? Is it okay to put it in the household waste, or should you find a way of otherwise of disposing of it? And one last comment. Um, it's so important to give training to people involved at every step of this process. The thing is, sometimes the training is given and then, as was mentioned, it's not repeated often enough because you have, for example, people who didn't get it the first time, or you have generations, new workers, and so on, who need to get that training. So I'll
Yeah.
wait for my response about the bandages.
Yeah, so bandages, I mean, it's quite difficult to have a system in place to have separate collection of bandages. And so what I recommend is simply to disinfect the bandage, so to spray it with some bleach.
Okay.
And then you can put it um in the
Household.
waste. Having said that, I am not 100% certain of your own legislation in that regard, because some areas may be more stringent. So it's worth finding out if there are any um, restrictions against that. But generally speaking, that is indeed acceptable.
I've never heard of anything. This is the first time I'm actually hearing this detailed presentation about waste. Maybe because I don't work in a healthcare environment, but just for the general household, waste. I know there's the recycling and the general waste, and the recycling, to my knowledge, is usually things which are like plastics and bottles,
Yeah,
containers, but nothing about the different types of household waste apart from that.
yeah. Okay, great.
I'm
So
gonna
then, yes, we should be good.
put Matthew on the spot in a way. You, environmental health director, do you have any comments, questions? Does this stuff come up in your work, Matthew? Matthew Tyler. Not there? Okay. Yeah, he's a environmental health director in Ohio, one of the counties in Ohio. Yeah, because I also wanted to look at because I haven't heard a lot of what we were discussing here today about medical waste and healthcare waste management in the US. It's not been on my radar. And so I was just wondering if anyone else in the US has any comments on that or insights.
I certainly don't.
Yeah. So, for example, too, we have a former city manager, Ellis Mitchell. Ellis, do you recall any sort of attention being paid to this in your role as a city manager? No? Okay. No response from Ellis. All right. Any other questions or comments? All right. So it sounds like
I would just like to say thank you very much indeed for this presentation. I am sure it has raised a great deal of awareness, and I will definitely encourage people that I know to listen into the recording. Thank you very much. And thank you, Ronald Roach, thank you for targeting him, and thank you for the presentation.
Yeah, bringing this awareness to us is really, really good. Yeah, because
if I
again, like you said at the very beginning, it's not an area that has a lot of attention paid to. Even here in the US, there might be, the relevant laws and stuff, but yet the discussion and awareness about it, I don't think is there. See, Bridget?
Yes, and thank you for the presentation. I am very interested in the advocacy uh, for this cause. Where does it begin? Does it begin with a research class at the university? Does it begin with a professional who has encountered the challenges? Who begins the process of, of creating the law? What would you suggest?
So, yeah, I mean, it has to me to be all encompassing. So we spoke about, just identifying some of the problems to the authorities, to the Ministry of Health, to the environmental management authorities, where they do exist, to the waste management authorities. At the level of the Caribbean Water and Wastewater Association, there is some discussion taking place about overall need for improvements in the policies and procedures surrounding waste management, and medical waste management has been identified as one of the issues to be addressed. So at that level, they're looking at a regional approach to it in terms of having a template, a policy template that each of the islands can adopt and refine for their own purposes. And some things are happening. There has been actually COVID has generated a bit of interest in the subject once again. So in Trinidad, in Haiti, in St. Lucia, in Jamaica, there have been a number of recent initiatives to assess the medical waste management situation and make recommendations for improvements. The World Health Organization and PAHO have been involved in that. Some things are happening. Unfortunately, it's not happening at the rates that we would like it to happen, and with the involvement of all the parties concerned. But at least, yeah, things are beginning to happen. But I agree, certainly at the university level, especially in terms of the research, understanding the magnitude of the problems, I don't think enough research is going into that. So what happens? What are the effects? What are the implications when waste ends up in the landfills? And as Nisha said, the general public interacts with syringes and tubes and so forth. I think more research needs to be done in terms of how much is it happening and what are the implications, so that can then be used to justify the solutions.
Absolutely. I'd like to see whether there's a straight line to autism, ADHD, these things from medical waste. I think I see a representative of UE here, and I know USC is on the line. I think it would be an awesome collaborative, especially throughout the Caribbean. Maybe CARICOM can be involved. We really need to know.
Yeah.
Yeah, I have one last question about your organization. You might have explained it at the beginning and I missed it, but is it an NGO? Is it a private organization? Where do you get funding and so on?
Yeah, so I represent Unite Caribbean. We are a private organization. Interestingly enough, we are just about to set up an NGO. So the company is Unite Caribbean. The NGO is called Impact Caribbean, and the names are inherent in terms of what we do. So Unite Caribbean, trying to understand the challenges that we face in different sectors in the Caribbean and develop approaches to those challenges that are cross-cutting and that that can be applied to the various countries, and then Impact Caribbean being able to make an impact on the ground in our Caribbean countries. So yeah, I mean, the work that we do, we have been involved in, we operate in 4 thematic areas: climate change, environment, water and waste, couple of them, and we yeah, we go after tenders. So we have been involved in medical waste management work in Trinidad and Suriname, St. Kitts and Nevis, Antigua and Barbuda, St. Lucia, and now currently involved in a project in Haiti. So yeah, we're quite involved in medical waste management in the Caribbean. It's one of our strong points. And you know, besides that, we also advocate for improved waste management. So through the Caribbean Water and Wastewater Association, which we are quite aligned to. I was a previous director, but I'm also the chairman of the Waste Specialist Group at CWWA. So I use that forum to promote, again, regional approaches to these waste management issues that we face.
Okay.
So do governments fund or private companies, or how do you get funding?
So generally governments don't fund. It's generally through different funding organizations. So the World Bank, so the St. Lucia project was a World Bank funded project. The Trinidad project was funded through the Basel Convention Regional Center. The project was funded through the French Development Agency, the one in Haiti. And so, yeah, different funding agencies providing support to the governments to be able to, yeah, to understand and address the issues being faced.
So we've gone past the top of the hour here.
Do we have a number and contact, sir? Because
yeah, I could provide that. Yeah, I
yes,
could provide that.
I have funding for research and I'd like to be in touch. Thank you.
Okay, we could connect you. So
yeah, I'll just quickly put it in the chat as well.
okay. Okay. So yeah, we want to thank everybody. It's been a pretty robust discussion. And this is the sort of thing I think Ronald would agree that would help inform the public, make them more aware of this area that is sort of like under addressed. And so we'll definitely have this on our YouTube website, on our YouTube playlist, and I'll send that information to each of you and you could share it with others. So thank you, Ronald. Thank you, Lisa. Thanks to everyone who participated, had comments, had questions. I learned a lot today. And again, hope you guys all have a wonderful weekend. And we'll see you back here next week, Friday at the same time for Environmental Fridays. Thank you all.
Thank
Take
you all.
care.
Thank you very much.
to the speaker, host, and everyone, and you, Dr. Mary.
Thank you. Bye-bye.